We are only a couple of days away from the National Opioid Awareness Day, and we're pleased to share with you some new insights that we have gathered as we continue to investigate the use of opioids in treating pain for injured workers. If you are in the workers' comp space, you would have heard the following all too often. Opioid prescribing is decreasing. Prescribing trends are changing, and on and on. And that is true. What we would like to offer you today is a perspective on a few trends and their implications. First, we're going to break down the decrease in opioids into the first year experience and beyond. And we do that so that you can learn not only how the share of opioid claims has changed, but also how much of this painkiller is prescribed and the change in that pattern. This will provide a perspective not only on where we are today, but also where we're heading with initial prescribing practices in workers' comp. We will then examine opioid use beyond the first year of injury and persistency rates. We will also have some concluding thoughts before we entertain questions that you might have. So let's begin. And first thing, we want to understand the data that we use. A big thank you to our affiliates who provide the detailed medical data that allows us to conduct this kind of insightful investigation. We also use other data that we collect to provide a full perspective. All statistics provided in this presentation relate to lost time claims, or what is sometimes referred to as indemnity claims. Our measure of opioid utilization is the standard morphine milligram equivalence as defined by the Centers for Disease Control and Prevention. For reference, a 10 milligram Vicodin pill is equivalent to 10 morphine milligram equivalents, or MMEs for short. A 20 milligram oxycodone pill amounts to 20 MMEs. Now, back in 2016, the CDC issued opioid prescribing guidelines for treating chronic pain. The guidelines essentially stated that prescribers should avoid increasing dosage to more than 90 morphine milligram equivalents per day, or carefully justify a decision to titrate dosage to more than 90 MMEs per day. Based on this, we've defined three levels of opioid utilization as follows, and as you see on the chart there. Low means less than 350 MMEs. Medium means anywhere from 350 to 1,050 MMEs. And high means more than 1,050 MMEs. Okay, we're now ready to explore the first year trends in opioid prescribing. So let's do it. The first view tells us that as of December 2023, the share of injured workers with a workers' compensation lost time claim who were prescribed an opioid, that has decreased from 43% to 16%. That's a two-thirds drop in injured workers with opioids. And as you see in this map of the United States, for states included in our study, that drop in share of claims is widespread across the country. But it also does vary across jurisdictions from a low of 37% in Nebraska to just under 90% in Rhode Island. We also see a decrease in the share of opioid claims for common medical conditions. This is most notable for low back pain and for neck pain. We see the impact on soft tissue injuries as palpable, and that would reflect a change in the demographics of injured workers and industries impacted. Importantly, surgery is a critical factor when it comes to pain management. In fact, according to one study on opioids prescribed after low-risk surgical procedures in the United States, back in 2012, some 80% of patients filled an opioid prescription within 7 days. Now, as you can see from the data shown here in dark blue, workers' comp did a little better than that. Back in 2012, some 64% of injured workers undergoing a major surgery were prescribed an opioid. From 2022, that percentage is down to 36%. Still a sizable share. Now let's keep that in mind when we will describe opioid dosages. Speaking of dosage, recall that we define the high dose opioid prescribing to be in excess of 1,050 mmes. Now check out that decrease. Back in 2012, you can see that in green, 15% of injured workers received a high dose opioid prescription. Come 2022, we're down to a mere 2%. Folks, this is an 89% decrease in the share of injured workers receiving a high dose of opioids in the first year after injury. And as you might expect, the 89% drop is pretty much consistent across study states with some limited variation. The message and understanding of the seriousness of high dose opioids today has pretty much taken hold among prescribers, those who are being prescribed the opioids, claims managers, nurse case managers, well, really, across the board. And yes, we see the decrease across medical conditions, notably for injured workers with a low back disc condition. So you might wonder, what about those undergoing surgery? We have the answer to that right here. It used to be that roughly 1 in 4 injured workers with a major surgery were prescribed a high dose of opioids. We are now down to 1 in 25. So you see in blue, the share of injured workers receiving opioids is on the decline. In green, you see those receiving a high dose of opioids, and that's also on the decline. But just as importantly, among those who are prescribed any dose of opioid, the fraction who are prescribed a high dose is also on the decline. We see that in the orange line on the chart. One thing to bring to your attention, though, notice that decline in orange is slowing down. In 2022, the CDC released updated guidelines that alerted prescribers to the various factors to be taken into consideration when prescribing opioids, insisting that these guidelines are just that. They're guidelines intended to be flexible, to enable person-centered decision making, taking into account an individual's expected health outcomes and well-being. With that in mind, let us explore what has happened to opioid dosages over the last 10 years and what that means going forward. Just as a reminder of the data we're using and how we measure dosage. Remember, morphine milligram equivalents, or MMEs, are the units that we use. Okay. And here is the change in prescribing patterns. Back in 2012, we saw some 1,800 MMEs per claim. That's the equivalent of some 60 20 milligram oxy pills. Now, as of 2022, you see there, we're down to roughly 20 oxy pills, or 600 morphine milligram equivalents. So we're seeing a drop of 2/3 of the amount of active ingredients in these opioid medications being prescribed. That is the decrease per opioid claim. Notably, however, this drop in opioid dosage was steadily coming down at some 13% a year through 2018. Since then, it is still coming down, but at a much slower rate, some 3% annually. In other words, the decrease in dosage is on a slowing trend. And this may be an indication that the drop in opioid utilization is starting to level off. That said, as we saw earlier with the share of claims, this 10-year decrease is also prevalent across study states. In this case, we see less variation in the level of decrease across jurisdictions in general. So the next question is, well, what happens when we put both the share and the dosage together? What trends do we observe? Here's what we get: a full 88% decrease in opioids over the 10-year period. 88%. And here we see that while the dosage decrease was subsiding some after 2018, in the overall picture here, there continues to be a 19% annual decrease in opioid experience throughout the 10 years. And to no surprise here, the overall 88% decrease in the amount of MMEs per lost time claim, that prevails across the nation. Now, all that we've talked about thus far relates to the injured worker's experience within 1 year of their injury. While 1 year information is useful, when it comes to fully understanding opioid use, we need to look at the level of persistence in that use. According to a study that concluded a comprehensive literature review, long-term opioid use may have significant effects on the endocrine, immune, cardiovascular, respiratory, gastrointestinal, and neural systems. The review revealed that long-term opioid treatment increases the risk of fractures, infections, cardiovascular complications, sleep disordered breathing, bowel dysfunction, overdose, and mortality. So, yes, we need to be diligent when we in the workers' comp system have injured workers that are on a long-term use of opioids. Legacy cases exist. In fact, our data shows that in 2022, about 70% of morphine milligram equivalents were prescribed to injured workers more than 10 years after their injury. Let's, for starters, examine opioid prescribing 3 years after injury. We start with 2012. For those injured workers, some 43 out of 100 workers were prescribed an opioid 1 year after injury. As of 2015, 3 years later, only 4 injured workers were prescribed an opioid. If you divide the 3.6% by the 42.9%, you get an approximate persistency rate of 8%. Now let's talk about injuries that took place in 2020. Out of 100 injured workers, 21 were prescribed an opioid 1 year after injury. Of those 21, only 1 got prescribed an opioid 3 years after injury. So the persistency rate here is 1.2% divided by 21%, which is about 6%, less than that 8%. So from 2012 to 2020, the persistency rate has decreased from 8% to 6%. Now let's look at these for high dose prescribing. Again, we start with 2012. And here you can see about 15 out of 100 injured workers were prescribed a high dose of opioids within 1 year. 3 years later, in 2015, only 2 injured workers were prescribed a high dose of opioids. If you divide the 2.3% by the 14.7%, you get a persistency rate of 15%. Now note, this is higher than the 8% we saw for all opioid users. Next, let's take a look at those folks who were injured in 2020. Now, out of 100 injured workers here, three, we're rounding up that 2.6%, three out of 100 were prescribed a high dose of opioids. Of the three, only one got prescribed a high dose of opioids 3 years after injury. So, the persistency rate here is 0.5% divided by the 2.6%, and that's about 19%. Two important observations here, folks. First, the persistency level for high dose recipients is consistently larger than all opioid recipients. That makes sense. One potential reason is that the condition is more severe to begin with, and thus the likelihood of continued opioid use is larger. The second observation is that for more recent years, 2020 we saw, right? We have fewer injured workers getting the high dose of opioids. That also means the more severely injured workers are the few that get the high dose. Consequently, the propensity to continue to get that high dose 3 years down the line is elevated. So now we look at this persistency level over the years, and we see that while it was on the decline through 2016, the 3 year persistency level is now on an upswing for the reasons we just talked about. Another underlying factor for persistently high dose use of opioids is the addictive nature of the medication. We can see this to be even more pronounced 6 years after injury. So let's take a look. Here we start with a persistency level of 25% back in 2012. That's for folks who were on a high dose at 3 years after injury and continue to have a high dose 6 years after injury. Now you see that 25% come 2017, 5 years later, we have a slightly higher level of persistency at 31%. This is to say, it gets progressively harder to wean an injured worker off of opioids as time goes by. And that explains the fact that 70% of morphine milligram equivalents, or MMEs, prescribed in 2022 were for injuries that took place more than 10 years before. And it also indicates that managing opioid prescribing at the early stages of the injured worker's journey to recovery is indeed critical. So you ask, what does this all mean? Our takeaways here revolve around three themes. First, the share of opioid claims is down, and particularly the high dose opioid claims. Those are down to a mere 2%, and the decrease is prevalent across jurisdictions. Second, the amount of morphine milligram equivalents prescribed that further accelerates the decreased use of opioids in treating the injured worker's pain. There is some deceleration in the decrease in dosage, however, and that is an indication of some leveling off. Finally, persistency levels. Persistency rates at 3 years and at 6 years reveal an important phenomenon, as the level of prescribing seems to have become quite limited in the first year after injury. Potentially, only the more severe of conditions are prescribed opioids over time. The persistency rate has already leveled off and is beginning to increase. Now, folks, we know that pain is here to stay. It exists in our world of workers' comp. It's part of the baggage we carry along. The question is, if not opioids, what is it that we're seeing in the treatment of pain? Is it more physical therapy? Is it cognitive behavioral therapy? Or is it cannabis where allowed? Or virtual reality? The FDA recently approved a program, an in-home virtual reality treatment of chronic lower back pain. New approaches to treating pain have cost implications, and those are an area of investigation for us here at NCCI. Managing pain, as physicians and carriers have shared with us independently, that is indeed a complex process. As such, it requires resources and special attention, particularly when the pain is a chronic condition. And as we've seen in the data, it becomes more critical as time goes by. Many thanks to our key researchers in this investigation, my colleagues Kirk Bitu and Chase Rice. At this time, I'm happy to entertain any questions you may have. If you haven't already done so, please be sure to share your questions in the Q&A section there on your screen. But before we do so, and in commemoration of the National Opioid Awareness Day this coming Saturday, NCCI is raising awareness and recognizing the individuals and their families and those who are impacted by the opioid crisis. To show support, we have turned our NCCI building lights to purple, as you can see in the image. Okay, I'm now ready to answer questions. And so here's the first one that we have received. The question reads as follows: what can this information tell us about future trends in opioid use? Well, thanks for the question. We really can't foretell the future. That said, as the trends indicate, the decreased use in opioids is clear. Fewer injured workers are being prescribed opioids from the get-go. So we've seen the dosage, though, that's continuing to decrease, but at a reduced rate, which kind of indicates that there is some leveling off. That's one question we got. Next one. Next one is, what is the point of noting the opioid use has gone down in workers' comp? What now? What should we do with this information? Great question from one of our participants. I think one of the key features in what we're trying to say is that it's important to pay attention to the management of claims from the medical perspective, specifically the opioid use from the get-go. Because what happens at the early stages of the injured worker's recovery is critical in terms of the ongoing treatment and how that the outcome from that treatment. So what's important in noting what's happened in terms of opioid use is really to address the trends and be aware of those trends and then act accordingly. Right. Let's go to the next question. This one is, how have mortality rates been impacted by opioid trends? On a countrywide basis, we know that one of the major reasons for a decrease in life expectancy has been opioid and other drug overdoses. That's one of the major reasons for that change in the life expectancy here in the United States. So it has impacted on a general basis. We did not really look at this from a workers' comp perspective. So at this point, I can't really answer that from the workers' comp perspective. Next question is, does NCCI have any insight on the workers' comp trend to the overall national trend across healthcare? So yes, we do, in the sense that from the get-go, I think what we've seen is that in the workers' comp, injured worker space, we've seen less general use of opioids than we've seen in the general health overall. The decreases that we've seen here, while there have been decreases in the general healthcare, I did not look at specific percentage decreases and compare any more about that. All right. One more question that we got, and here the participant is asking, what are some of the alternatives to opioid prescriptions that are more widely used in workers' compensation? Okay, so that's a very good question. And we keep asking ourselves in the workers' comp space, what is it that's replacing the opioid? What's going on? Um, from a non-pharmaceutical approach, we see continued use of steroid injections and physical therapy. We also see some cognitive behavioral therapy and other new approaches like the virtual reality treatment and mindfulness. Mindfulness. Um, for prescription drugs, what we see is an increased use of topical gels and creams. Uh, that those have been increasing at a very high rate. We also see continued use of Lyrica or its generic equivalent, the pregabalin. Let's see, we've got one more question here. What does what impact does a claimant have long-term use of opioids, especially high dose, on the duration of the claim or the total medical cost for the life of the claim? So that's an interesting question, but we don't really have uh, data just yet in terms of trends on the long-term use and its impact on durations. Our duration data comes from the indemnity data call, which started back in 2020. So we only have very limited information as yet. So we haven't looked at the, say, return to work or those kinds of durations just yet. But what we do know is that we do see opioid use 10 years and 20 years beyond the injury. I mentioned in our webinar here, we see some 70% of the morphine milligram equivalents being prescribed for injured workers 10 years beyond the injury. And it goes up to something like the early 82, 83% 5 years after injury. So there's certainly an important trend, an important share of opioid prescribing that takes place for injured workers who are not completely and continue to have the pain. Okay, one more question. Do decreases in opioid prescribing typically correlate with lower claims severities? So we have not looked specifically at that. So I can't really comment on the low severity and any correlation as such. We do know that opioids prescribing 3 and 6 years down the line do correlate with more expensive. The subsequent prescribing of opioids does take place for mostly injured workers who are severely injured. With that, I think I've come to the end of our session today. I want to thank you for your attention. Please fill out the short survey so you can help us deliver the information that you are interested in. Be on the lookout for NCCI's new podcast called The State of the Line, which will be launching soon. Also, a reminder to save the date for our 2025 Annual Insights Symposium taking place in Orlando, May 12th through the 14th of 2025. And as always, we promise to deliver new and exciting information and insights. Thanks again for listening.